COVID-19. We'll talk about that in a bit. But before, we wanted to have a shared understanding of what do we mean by a good measure. Uh, when we talk about measurement, there are a couple of terms that always keep coming up. Terms such as survey items, scales, uh, measures, vignettes. When we talk about survey items, we mean that uh, those individual components or questions of a measure that 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 come together to create a measure of a construct. These are the smallest unit that comprise a measure. Whereas when we talk about scales, we refer to the collection of items combined into a composite score. Vignettes, on the other hand, are although less commonly seen in surveys. These are mechanisms uh, to capture things such as social norms, and they allow for a greater detachment in survey responses. Uh, Apart from these terminologies, we also wanted to have a shared understanding of what it means to have a good quality measure. And while talking about a good quality measure, a lot of the times we talk about psychometric properties. And these psychometric properties are divided into two broad groups. One is validity, which tests if the measure captures what it is intended to capture. Uh, it's generally classified into three subgroups. So there's content validity or face validity, which essentially means that the measure that we have, the items that we are using for the measure, is actually capturing the construct that we are trying to measure. Then we have criterion validity, which gives us a sense of how a measure that we have uh, performs in comparison to a gold standard measure that perhaps already exists in the field. And finally, we have construct validity, which helps us in understanding how how do the constructs that we are measuring through our measure relates to some of the other related constructs. So, for example, if I am trying to create a measure on agency. My measure on agency, if it is really good and it really has good construct validity, should ideally correlate positively with some of the other related constructs, say self-efficacy or autonomy. So that's construct validity, and these three types of validities come together to give us a sense of if we are capture if the measure that we have created captures what it was intended to capture. Then we come to the idea of reliability, which tests how consistent a measure is. And broadly, reliability can be thought of in two big buckets. Uh, One is internal reliability, which means how well items within a measure hang together with each other. How well are the items linked with each other? For example, if I have a measure of, say, decision making, and I have 10 questions that talk about decision making at the household level, and in that set of 10 questions, I try to add a question that is not related to decision making at all. Say it talks about mobility or freedom of movement. When we include such an item that does not relate to some of the other items on decision making, the overall reliability of the measure would go down. And it would go down because we are introducing items that do not hang together well, which decrease the internal consistency of our overall measure. External reliability, on the other hand, talks about how consistent our measure is upon repeated applications. And repeated applications could be thought of in two ways. The first is a test retest. So if we if we apply our measure to the same population at two different points of time, it should ideally generate similar responses, and the two responses should correlate with each other really well. If it does not, that means that our measure lacks external reliability. Another way to think about external reliability is to think of inter-rater reliability, where we mean that if different investigators are using the same measure, in such a case, if our measure is really good and it really has good external reliability, then the responses that different investigators and different raters get should correlate with each other really well. So with these ideas, we proceed with thinking about how to identify and select measures uh, to study gender equality and empowerment during COVID. A couple of things to keep in mind is that whenever we are trying to adapt existing measures, we should be thinking of measures that have good reliability and good validity, possibly those that have been tested before, and adapt them to our cultural or socioeconomic setting. This brings us to the topic of what key areas of gender equality and empowerment should be surveyed at this time. And we all know, and all of us have been following this uh, pandemic quite closely, and we all know that more number of cases and deaths are getting reported among men. Uh, we are already seeing elevated partner violence. We have a disproportionate burden of domestic work on women. Uh, we also know that uh, women form the majority of the healthcare workforce. They are at the front lines, and they are also the primary caregivers at home. So some of these topics on gender equality and empowerment are really important for us to study during the COVID-19 pandemic. In addition to these topics, some of the issues for adolescents are also important for us to consider. For example, it's coming out now that girls may be more vulnerable to drop out from school after the pandemic ends. There's a greater household burden for girls, and that may offer less time for them to study, and that might impact their educational attainment in the longer run. We are also expecting increases in child and forced marriage, sexual exploitation of adolescent girls, and lesser freedom for girls in households with greater presence of males. So these topics really motivated us to develop modules that practitioners and researchers can use in the field. Uh, over the past couple of months, have put on 13 different modules on these topics on our website. And these topics can be viewed on our COVID-19 page on Emerge. These 13 modules are absolutely free to use. Uh, when you click on any of these modules, you would see that there's a set of questions that we have put together on different topics. For example, this topic is on women's and girls agency, and we have several sub modules that we have within this topic. So we have a module on household decision making control. We have added questions and response options. What we have also done is to provide the sources from where we adapted these questions, so that practitioners or researchers who plan to use our modules can also go back to these sources and see if there are other questions that fit their context as well. We have additional modules on freedom of movement, gendered constraints on women's and girls' behavior in household, locus of control, coping, and so on. And we are also working towards adding more and more modules to cover other important areas of gender equality and empowerment. One thing for us to keep in mind is that since the topic is very fresh, all of these modules have just been developed, and these modules, as they stand, have not been tested for psychometric properties yet. So while we have referred to sources that have good psychometric scores or have good reliability and validity, the way that we have organized these modules, this structure per se has not been tested in the field. Uh, while we would love for any researcher or practitioner around the globe to use our modules and collect data based on that, we would also love to hear from you on how that data collection goes, how that survey goes. Any feedback from you emerging from the field would be really helpful. And if if psychometric properties are tested on these modules, we would also love to hear on that. This brings us to our next section. We would like to welcome Dr. Karen Austrian from Population Council Kenya to share some of the insights that are emerging from the field during the COVID-19 pandemic as it relates to gender empowerment and gender equality. Dr. Austrian, over to you.
Hi, thank you so much. So maybe I will just give a quick background of what we've been doing in Kenya. So we have collected 4 rounds so far of COVID-related data. So we the first case of COVID was mid-March in Kenya, and at that time we went to the Ministry of Health and said, how can we help you? And they asked us to do a CAP survey in the informal settlements in Nairobi, and we leveraged 2 current cohorts that we had, and we sampled from those cohorts and started collecting data. And so the sample is about 2/3 women and 1/3 men, which is it allows us to make comparisons between men and women, but then also have enough of the sample of women to look at impacts on some more female specific issues. While the initial survey in March was very much about knowledge and attitudes directly about COVID, we have since been asked and have been collecting data on a monthly basis. And we, starting in April, started adding a series of questions that help capture some of the social, health, and economic effects of not specifically the virus, but a lot of the prevention measures, the containments, the lockdowns, and the virus prevention measures. So here, just on this slide, what you see, so at first the measures we were using were just pretty basic and simple. But we can see that women have been impacted more on a number of social health and economic dimensions. So food security in general has come up as a huge issue, with about 3/4 of the population skipping meals. But we see that even within that, women are skipping more frequently than men are. We also see people are skipping healthcare services with women, and this is our June data, so almost twice as likely to be skipping healthcare. Then also you can see really stark differences in terms of who is taking on that domestic burden in terms of cooking, cleaning, childcare, and then also looking at some violence. So more reports of tension in the household, violence in the household, etc. So these are some of the issues that we have seen coming up in Kenya in the urban informal settlement environment, and so we've actually been fortunate to partner with Emerge more recently, and so we are have in June and going forward are going to be starting to use more of the Emerge measures that were discussed, and I'll talk a little bit about some later in the presentation preliminary experience using those methods, but also the adaptations that we've had to make in the field in terms of delivering a survey in the context of COVID. So I think I'll pause there unless, I don't know if there's questions or whatnot, but I think maybe that's my snippet for this point of the presentation.
Thanks so much, Dr. Austrian. That was really wonderful to understand some of the insights that are coming up. I'm really glad to see some data points coming out on COVID on some of these important issues. As you rightly mentioned, we will now be talking about some of the more practical considerations for conducting surveys. And when we have a set of modules, or we have a source of adapting such modules, the next important question that arises at the time of COVID is, how do we conduct surveys on gender equality and empowerment ethically and safely during this pandemic? And before we even get into some of the practical and logistical considerations, I think it's really important for us to acknowledge that any survey and any data collection imperative needs to be thought through really carefully. Uh, COVID-19 has really increased the responsibility on researchers to conduct surveys that are meaningful and contribute to the science and community. Research constraints deal with aspects such as time, funding, situational or personal details that one considers when thinking about how the selected measure will be administered. Before initiating surveys, we need to make sure that our surveys are to the point and only include such items that help us in answering research questions and to describe our sample. Uh, One clear guidance would be for us as researchers and practitioners to be absolutely clear about our research questions well ahead of time, and limit our survey measures to those that can answer only those questions, and not to add additional questions at this time that can further burden our respondents. We also need to be super clear on how our data will be used to contribute to impact, especially given the circumstances of the pandemic. Uh, this brings us to some of the practical and logistical considerations that we need to make to conduct surveys at this time. Uh, Generally speaking, in-person interviews at this time creates a lot of risk for viral exposure, both to interviewers as well as to interviewees. This can, however, be reduced by innovative methods such as, conducting interviews from a distance, or creating surveys that can be self-administered, and taking tablets to the households, or tablets to the respondents, and handing it over to them from a distance so that they can fill it up on their own and give us the tablets back. Uh, Considerations of sanitizing such tablets need to be made while designing such surveys. However, this also means that these methods might affect confidentiality and data quality as well. So those are some of the considerations about in-person interviews. We have been hearing from India and from other places that some of the studies have started uh, collecting in-person interviews, and we would love to hear about some of those experiences. However, a large proportion of interviews are being conducted telephonically at this time. The challenges with conducting telephonic interviews are that they yield greater bias in sampling and can affect confidentiality as well. Uh, Another consideration for developing telephonic interviews is that they need to be short. Extremely long questions or extremely long response options might just lead to respondents not getting what we are trying to ask at all. Uh, a lot of times while conducting in-person interviews, we are used to create these modules or tables that are really complex. Uh, that that does make sense when we do in-person face-to-face interviews, where we have an opportunity to explain our questions, where the respondent has the opportunity to look at us, to view our expressions, and grasp what we are trying to ask. However, we do not enjoy such kind of a luxury in doing telephonic interviews at all. Uh, so I think the key that we are finding while developing some of these modules is simplicity itself. Uh, we need to make sure that the items that we are developing, the structure of the modules that we have, are broken down into as small pieces as we can, uh, so that the items are easy to administer, uh, and so are the response options that we have for such items. Having really complicated ways to fill in different response options might lead to data quality issues, or might even lead to respondents not comprehending the items and the response options at all. So it's super important that we are absolutely clear on the study design, on data collection and management aspects as well. Uh, we tried to address this issue of conducting telephonic interviews by creating a, a protocol recommendation for conducting phone-based surveys. This can be found in our website right here on the COVID page, where we have a protocol recommendation for conducting phone-based surveys. This protocol really talks about how to create rigorous, valid, and practical surveys. We have several pointers to do just that. This talks about ensuring clarity on key gender constructs that we are trying to measure. It talks about adapting items and responses to our specific context. And it also points to other resources that we can always leverage while doing telephonic interviews or while creating survey modules that address GEE during COVID. Um, Apart from these considerations, the protocol also uh, contains guidance on sampling and respondent characteristics and circumstances. We talk about how to prepare a clear sampling frame. We talk about how to clarify the eligibility of survey respondents, how to include key questions on socio-demographic characteristics so that we can profile the sample that we are going to. Uh, uh, it also talks about ways to be really respectful of culture, the time of the participants, and circumstances of the respondents. Uh, Finally, we have a section that talks about minimizing risk regarding participation safety when assessing gender-based violence. Uh, Recently, WHO and UN Women has come up with guidance which recommends against including assessment of and experiences of GBV in surveys, particularly when we are using remote data collection methods. However, recognizing that this is a super important topic to understand and measure to influence policy during pandemics in the future as well, we have come out with pointers for us to consider if any of the practitioners or researchers are going to the field or conducting telephonic interviews on gender-based violence. Some of these pointers include selecting only one woman or girl per household as per the WHO sampling guidance. Uh, Another a couple of points that are very important for us to consider during telephonic interviews while assessing GBV is to focus on training the investigators who would be collecting data. And these trainings will have to be different than some of the other trainings for in-person interviews. One important point for us to consider is that investigators who would be conducting telephonic interviews are very sensitive to pick up signals of distress, so that whenever a respondent is uncomfortable in responding to a particular question, or in responding to the survey as a whole, the investigator is sensitive to such signals, and is able to act on that immediately, so that it does not put the respondent at risk at any point of time. Uh, the second thing that's super important for us to consider is to train investigators who will be conducting telephonic interviews to be resourceful enough, and to have the knowledge of gender-based violence support services that can be offered to respondents at the completion of data collection. Uh, Again, keeping in mind that assessing any measure on gender-based violence is in itself a very sensitive issue, even when it's conducted through a face-to-face mechanism. The sensitivity only increases when we are trying to assess GBV telephonically, and we should do everything that is within our means to ensure that we do not add any kind of stress or any kind of pressure on respondents, or put them in harm's way at all. The last thing which we always do in face-to-face interviews is to ensure that respondents have privacy. Whenever we go and conduct surveys in the communities, we ensure that nobody is around the interviewer and the respondent. This is a little bit difficult to do in telephonic interviews. However, clear guidelines on conducting these interviews passed on to investigators can ensure that we ask our respondents to go to a private space, to secure a private space, and continue with our surveys only when we are sure that uh, uh, we have complete confidentiality and complete safety for our respondents. Uh, that is a major section in the protocol. We also have interviewer training protocols and protocols for interviewer supervision and monitoring. Uh, the protocol also talks about how to improve phone survey implementation signs. What are the steps that we need to take before the interview, uh, at the start of the interview, during the interview, and at the completion of the interview, uh, while conducting telephonic surveys. In addition, we also provide a lot of additional resources in the guidance for us to consider while designing such a survey that measures gender equality and empowerment during COVID. Uh, so that brings us at the end of this section, and towards the section that Dr. Austrian was talking about, where we really want to learn from her experiences on what are the major challenges that we are facing when doing research during this time, and what would be some of her suggestions and guidance on managing such challenges and adapting research in this particular setting. Uh, Dr. Austrian, over to you.
Thank you. So I was just told I have a little bit more time than what I was originally allotted. So apologies that I only prepared one slide, but can you hear me okay?
Yep, we can hear you.
Oh,
and you have
okay.
And you have up to 10 minutes, but take however much time you'd like.
Thanks, Meredith. So apologies that I don't have slides, but I'll try to talk a little bit more through the process that we went through. So We are doing all of our interviewing so far over the telephone. The Population Council, our IRB, has stopped all in-person data collection to date, but also there's containment measures in Kenya on different parts of the country, so also people can't travel in and out. People are stuck in different places. But I think, for us, we weren't comfortable with this sort of elevated exposure risk to the virus that would come with an in-person interview. So all those reasons combined made us decide to move to phone-based interviewing. One of the first things that we did, just from before we even get to the tool itself, from a technology point of view, this may seem obvious, but the interviewers actually need two devices in order to conduct a phone interview. They need one on which we're using ODK, Open Data Kit, but there are a number of data collection softwares. But you need a device that runs that one, and then you need a phone. So it's not really that feasible or smooth to use the same device to both talk on the phone and enter the data. And so what we did was our initial survey, we literally had a week to get it together from the day of the request from the ministry to when we got into the field. So we were moving incredibly quickly. But so all of the interviewers, and it was sort of the day that things were about to go on partial lockdown. So anyone who didn't already have two devices quickly came to our office and signed out a tablet that they could use for data collection. The other thing that we had to adjust was our training. We're used to training our data collectors in person over longer periods of time, but here, both because of the rapid nature of our data collection, but we had to move everything to online training. So what we did, a couple of things that we did, one was, so we had about 75 interviewers, but we thought that that was too large of a group to train online in terms of chance to ask questions, to interact. So we divided the team into 4 groups, and we ran 4 concurrent training sessions. We started using WebEx, and we've shifted to Zoom. Just found it to be a little bit easier. So one thing we do is we've been pre-recording the training session, the PowerPoints, to ensure uniformity across all 4 training groups so that everyone is getting the same content. We also record the training sessions themselves because with the setting that we're working in doesn't always have very regular bandwidth internet support. So invariably there are always interviewers on each of the teams that can't connect at all, or they drop off for different parts. So they are required to go back and watch the entire training. We share the links at the end of the training. We've also had to split up the training days because people can't focus on webinars for all that long. So what we typically do is send out all the materials a couple days in advance. We ask them to review the tool, review the PowerPoints. We train them for a couple of hours. The first training was a little bit longer because we did go into, we covered ethics and the data collection software, but now that it's a monthly thing, we mostly, after each round of data collection, we send out a survey to the RAs, and they tell us what their particular challenges were, so we can design a session around the key challenges. But then we go through question by question, and we break for a few hours in which the interviewers do 2 practice interviews, and then they send their feedback to their team leaders. The team leaders feed it all into one document, and then we reconvene later in the day where we go through each of the issues that have come up across all of the teams and clarify. So we've had to really change our training methodologies to do not just phone-based interviews, but not be able to do in-person training with the data collectors. So I guess I'll talk a little bit about how we adapted the tool itself. So I think that Arna mentioned several of, I guess, the challenges with phone-based interviewing. The main one is that we found that people can't typically focus on the phone. It has to be around 30, 35 minutes max. And so that really reduces the number of items that you can ask, and it forces you to prioritize. The other things is that we've found that in order to keep people engaged on the phone, because you can't rely on body language and sort of the rapport that an interviewer does sort of in person, the reading of the questions needs to feel like a conversation. And so the way that you structure the conversations, and that was actually one of our challenges with some of the Emerge tools. And I know that we're going to debrief with the Emerge team about our experience using the tools, but a lot of them are set up like matrices, and those are really hard to deliver over the phone. And we had to sort of simplify them and restructure them so that it reads like a conversation. So that's one of the things we found, that it's hard to do something that's set up like a matrix. And then another thing is around the sensitivity of the questions. So we've had to, I mean, it's, we've done a lot of the things that Arda mentioned in their protocols. Every time before there is a sort of sensitive set of questions, there's a prompt on the tablet version of the survey for the interviewer to say, I'm going to ask some personal questions. Are you in a place that's confidential? Do you feel comfortable? Can I go ahead? And we've really trained the interviewers that we would rather have less data than bad data. So if somebody is not in a place where they can give honest answers, we'd rather they just skip that section instead of just having made up data. We have had a few cases where the interviewers have reported that the person has put the phone on the table on speaker, and they can hear people in the background like sort of giving them answers to say. So really training the interviewers to be aware of that. The other thing that we've done is change the way in which the responses are read. So for example, a question, maybe let's say about pregnancy, or something like, okay, which of the following describes your situation? Are you currently pregnant? Currently trying to get pregnant, not pregnant, and don't want to be pregnant, infertile. If you read it like that over the phone, the respondent would have to say one of those answer categories out loud. And therefore, if they're in a place where somebody might hear them, they might not be comfortable to say, for example, an adolescent girl might not feel comfortable saying, I'm currently pregnant. So we've trained and sort of reworked the question so that the interviewer says, say 1 if you're currently pregnant, say 2 if you're trying to get pregnant, say 3 if you are, et cetera, et cetera. So that way somebody who's currently pregnant would only have to say 1 out loud instead of currently pregnant. So different tricks like that to make the phone interviewing going a little bit more smoothly. We have also set up a referral process. So we've, in each of the sites where we're collecting data, we've done the work ahead of time to map out what the referral resources are. And then we have the referrals programmed into the tool so that if a respondent discloses, whether it's sexual violence or physical violence or suicidal thoughts, things like that, then it automatically prompts the interviewer to make a referral, etc. One of the things that has been challenging in these times is that the setting in which we're interviewing households are in extreme dire economic circumstances. People are hungry, people have lost their jobs, and we've really struggled to, our initial thought was to be able to make referrals, but all of the resources in these communities are overwhelmed and not able to, we reached out to all our contacts. For example, one person, he was like, well, you can tell them to contact me, but we have a waiting list of 2,000 households in order to get foodstuffs and things like that. So that's been a real challenge for our team in mitigating that. It's led us to decide to give a small incentive to compensate, or a token to appreciate people's time for participating in the survey. And I guess just I still think, despite all of that, so one of the things there are some issues in terms of sampling bias with phone interviews, and one of the things that we've been able to do to reduce bias is to sample from prior cohorts. And I think that by doing that, there's a few advantages. One is that those cohorts were established in a time where we could go face-to-face, do household listings, randomly sample, et cetera, so that we're pretty confident that these are the underlying cohorts are representative of these communities. It also gives us the benefit of having pre-COVID data on these households as well, which is useful and interesting in some of the analysis that we are doing. I'm planning on doing. And I guess I might just say one more thing about, I heard a suggestion around doing key informant interviews in lieu of gender-based violence. And there's nothing wrong with doing key informant interviews, but I might just caution to doing those alone. Because I think that sometimes extreme cases tend to get magnified. And one of the things that we're seeing in Kenya is that while maybe in the media, or is definitely on social media, there is a lot of discussion about very extreme cases of sexual violence and minors being raped and teenage pregnancy and things like that, but it's not showing up in our data. And I think that still being able to have quantitative interviews with a relatively large sample helps to minimize some of that I don't know what the official kind of bias it is. Like, I sometimes call it the drama bias, which is very unscientific. But that you tend to hear about the worst cases, and the worst cases get magnified, even if they're not the norm. So I think that's being able to do sort of large-scale phone surveys has helped us to balance some of what's coming out. So maybe I'll pause there. I don't know, Meredith, if there's a place for questions.
Yeah, thank you so much, Karen. That was very helpful and enlightening, and it's definitely interesting to hear how your experience and how you kind of applied some of the tips and guidance that we were sharing to your phone surveys and adjusting them for the situation there. We will take questions now. So I did see that you answered a question in the chat box, but just so that everyone has it, we had a question for Karen if she had disaggregated data by age, because folks were interested in knowing the impact on younger age groups. And I think you said you did.
Yes, so our sample has enough to disaggregate different ages of men and women, but also we started collecting data on adolescents themselves. And then I also put a link in the chat to all of our tools are available open source, and you can request the data as well. So the link to that is in the chat.
Great. Thank you. We had a comment early on that was really interesting when we were talking about the issue of women being the majority of the healthcare workforce on the front lines globally. And we had an interesting comment that PPEs are actually in a lot of places very large and made to the male standard. And then Annika linked that in the chat as well, a resource that talks about that. So I think that's an added component of the risk that women are facing in those frontline healthcare worker roles. We had another question from for Karen. Do you face any network challenges in Kenya? Sandra said that she has not been able to reach some target populations due to connectivity challenges and the service providers hiking prices every 2 months.
So far, we've been interviewing in Nairobi, and the network has been okay. We're about to actually start interviewing in a couple of rural areas, and we do anticipate having more network challenges. So we'll see how we overcome that. And I just wanted to comment that I also about women taking on the burden. Just another example that we have. So Kenya has introduced home-based care guidelines that so patients that are asymptomatic or mildly symptomatic no longer have to be kept in a medical facility. But we asked the ministry asked us to ask a few questions about acceptability and feasibility of home-based care. And one of the things we asked was, what is the gender of the person who is likely to care for that patient? And 2/3 of the response said women. So there is like yet another example of women taking on extra burden and extra risk exposure to COVID.
Certainly. We have two related questions that I'm going to ask Arnab to take a stab at. The first one is, how do you capture intersectionality, especially race, LGBTQ, caste, because they compound with issues of gender and access? And then another question, how can we study the gender equality amongst transgender folks and other non-binary genders?
Interesting. I think on the question of intersectionality, that's a super relevant question, because intersectionality would be it's more important to study now than ever. However, when we are doing telephonic interviews, I think there's a limitation for us to be in terms of the number of questions that we can ask and the details and the depth that we can go in. I think the smartest way for us to study intersectionality now would be to include as many determinants of intersectionality in our surveys as we can. So in the socio-demographic modules, we can and we should include questions on race, ethnicity, gender, including transgender and non-binary genders as well, so that can be at least analyzed at a later stage to see how some of these effects are coming together and compounding to determine outcomes. To the next question, I think it's a very important question, and I think the answer lies in sampling. So I really liked Karen's suggestion on avoiding sampling bias by using some of the previous cohorts that we already have. And I think such a methodology can also be applied to do research on transgender and non-binary populations, where if possible we can go back to previous cohorts that we have and sample from that cohort to undertake surveys that can draw insights on some of the issues that the populations are facing. Yeah.
Great, thank you so much, Arnab. So with that, we have reached the end of our time. We want to thank you all so much for joining us. Here's our Emerge team. Thank you so much for Karen for all of your insightful experiences and acknowledging our funder here. If you would like to check out our website and register for updates, you can go to emerge.ucsd.edu. And we also will be redoing this webinar at 9 p.m. Pacific time, which is 9:30 a.m. Tomorrow in India. Thank you all again, and we hope that you have a great rest of your day.